The interagency task force is set to convene today to tackle the spread of the new UK variant in the Philippines.
Right now, there's no evidence of that dahil meron po tayong isang cluster lang na alam naman po natin na magkaka-related sila. And then, we have to find where that person, yung siguro kung ano yung common source nun. And then the others, mukhang wala namang onward transmission. So right now, there's no evidence of community transmission. Doesn't mean that it's not there, but we will continue to look.
The infectious diseases head of San Lazaro Hospital stresses the importance of surveillance amid the threat of the UK variant.
The more tests you will do, the better you will have an idea and what is really going on, if there are other variants present here in the Philippines.
In the past few days, there have been mounting concerns over the increasing number of cases of the UK variant of COVID-19. And today, health officials say there are several clusters of COVID-19 cases, especially centered around the Bontoc area in the Cordilleras. What is the health department going to do about this? We discussed in this special episode of The Chiefs. Welcome to this Monday edition of The Chiefs. And of course, with us tonight are Robbie Alampay of One News here in the studio. And also joining us are Ana Marie Paminton of the Philippine Star in the port area in Manila. And of course, Luchi Cusvaldez, the head of News 5. Hi, Bossings. And hi, Robbie.
Hello. Happy Monday.
Hi, Robbie.
Happy Monday. Apat na araw na lang. Oh, what's our big story today? Of course, ang dami, no?
Dami. Well, sa Bontoc, binabantayan yung may particular communities na binabantayan ngayon ng DOH at saka ang gobyerno kasi may spike talaga at saka may UK variant.
16 na ang UK variant cases natin. And ang daming close contacts na nag-positive, although hindi pa sigurado kung UK variant din sila. But they're certainly close contacts. And these are, of course, areas of major concern. Maliban doon, nag-apologize ang AFP.
Yes, that's right. Dito sa yung na-post nila na
28 or 27 na
sabi nila inconsistencies daw. But of course, for the
Wala
people...
ba kayo dyan? Kayong dalawa. Wala kayo doon.
bakit naman
Wala.
kami nakita?
Hindi namin batch yun eh. Hindi namin batch yung mga nandun eh. It was based, according to Alex Padilla, this was apparently based on a list that was drawn up 40 years ago.
Oh.
So,
Bago dumating sa amin yung listahan, dadaan mo na yan kay Bobby Tiglao and company.
But yeah, they apologized. They said it was inconsistencies, of course, for Alex Padilla and a lot of the people there. They're saying that's not enough. Unang-una, call a spade a spade. They're saying it was not inconsistencies, and they're also saying they are considering filing charges.
Okay, and but going back to our first topic for tonight, we begin tonight with Undersecretary Maria Rosario Vergeire of the Health Department. Of course, to talk about many issues, including the issue of the UK variant and the new cases that seem to have come about in the last few weeks. Usec Vergeire, maraming salamat for joining us again, and welcome to the Chiefs.
Good evening po.
Evening po.
Evening, ma'am.
Yes, ma'am.
Magandang gabi.
Magandang gabi po. Ma'am, well, we of course are talking about the, I understand, 16 new cases ng UK variant. Pero maliban po doon, we understand that at least 34 close contacts have tested positive, although we don't know yet if they're UK variant cases nga, but they are positive for COVID-19. So it does seem to appear that yung index case na nandun sa Bontoc appear to have fallen through the cracks ng testing and quarantine procedures po. Kasi he tested negative eh. Kaya po siya pinauwi. Of course, we do know na it's a new virus. We are still learning a lot about it and we are still learning what protocols to implement. My question to you is this, do you see any need to overhaul or to amend and revise our current testing and quarantine procedures given these considerations? Meron po nakakalusot. It's not, I think 2 weeks ago may nakalusot din. That's why we are having now retesting.
Actually, sir, it's not really to change anything, but to strengthen what we are already enforcing or implementing. Just about 2 weeks ago, we were able to revise the protocols that we are going to retest on the 5th day because we know that it is more accurate, because we know that once a person has been exposed or will get the disease, on his 5th to 7th day, that's the most accurate time that you get the test, and you would yield more accurate results. So that is in place already. What we need to do for now, would be to encourage LGUs to strengthen their isolation and quarantine protocols as well as testing, especially in their borders, so that we can be able to manage and to control this interzonal transmission of diseases.
Yun po bang repeat testing, is that for all? And is that for purposes of identifying the variant, the possible existence of the variant, within the country? Or, so in other words, is that just for the OFWs coming home, or is that for everybody who
cases.
tests positive? Yeah.
Actually, the protocol would state that this would be implemented among those travelers who are coming from these restricted countries that we have identified, these 35 countries. But of course, I'd just like to make it clear that this protocol is really not specific for the variants. You would like to get all those positive cases as soon and with more accuracy. That's why we added this 5th day of testing. We confirm the variants through genome sequencing.
Ma'am, ito po bang itong sa Bontoc, so this is now officially considered and technically considered local transmission? And if so, does that trigger anything in our protocols and in our mechanisms?
The cases in Bontoc, yes, we are confirming that there is local transmission. But let us try to differentiate with community transmission.
Okay.
Community transmission is that case or status wherein you wouldn't find any linkage anymore, or you wouldn't find the sources of infection anymore in the community. But for these cases in Bontoc, we have identified a specific lineage or linkage among all of these cases, and that would be this UK traveler or balikbayan natin na taggaling sa UK na sa kanya po nakuha yung sakit nitong mga tao sa komunidad.
Pero yung sa team situation sa Bontoc, it shows na talagang medyo very infectious yung UK variant. Are you considering recommending na i-hold muna yung pagpapalabas ng mga 10-year-olds sa MGs, kahit MGCQ areas lang? Ang Department of Health ba, are you planning to appeal that decision?
Yes, ma'am. Actually, we have discussed this already, and together with our experts, we have tried to have some form of evidences so that we can be able to have this appeal. This is not really to stop the implementation of this expanded age, the lessening of the restriction. But what we would want is for it to be temporarily suspended so that we can have more time in determining if really the variant is in other areas of the country so that we can be guided in our actions.
Mga gaano katagal yung suspension na hinihingi ninyo? Because it's supposed to be February 1, in MGCQ.
Yes, ma'am. We are going to request for about 2 weeks because we would like that there would be 2 cycles of processing of this genome sequence so that we can see for sure if there would be other variants that will be identified, because now we are starting to collect samples from all regions of the country so that we may be able to determine really if there are existing variants already in the country.
Ma'am, klaruhin ko lang po
So, isa pa yun, ma'am. Okay.
Klaruhin ko lang po, ma'am, yung 12 po na nasa Bontoc na nag-positive sa UK variant, they all got infected from that one case who went home to Bontoc noong December 14. Tama ho ba? So, one naging 12, tapos naging, possibly naging 34 kung mag-positive nga yung gene sequencing.
Actually, sir, ito pong pagkaka-travel nitong balikbayan from to Bontoc, iyan po yung basic na premise na pinagtatrabahuhan namin ngayon. Dahil nung dumating po siya doon sa area, he had some celebrations with the family, with neighbors, and then he was the first one who started to have symptoms, and then he was tested positive, and then thereafter yun pong mga iba ay nag-umpisa na magka-simptomas at maging positive. So this is our working theory for now, but of course we are saying there is no definite conclusion yet because we would like to backtrace for other OFWs or returning overseas Filipinos who also went home to the specific area.
So, ma'am, klaruhin ko lang, yung pangalawang test, is that a test to determine if it's a variant or it's just a confirmatory kung sakaling negative sa unang test? at mas accurate kanyo yung 5th day testing, no? Pero iba pa yung genome sequencing na gagawin ninyo para malaman kung gaano na nga ba kalawak ang transmission ng variant. Ganun po ba yun? Magkaiba?
Yes, ma'am. The RT-PCR test would determine if you have the virus or not. So on the first day that they arrive here in the Philippines, they get to be tested. And that's part of the protocol. But for
Yes.
another layer of safeguard, we did include in the protocol that there should be this 5th day. That is also to confirm if talagang negative ka dyan sa RT-PCR na
Okay.
yan. Kasi kung talagang
Yes.
ikaw ay nag-i-incubate na, you will turn positive on the 5th to 7th day. Ngayon po, kapag kinukuha na ng specimen ang ating mga kababayan, 2 specimen po ang kinukuha natin mula nung inumpisahan natin ang whole genome sequencing na proseso. Yung pangalawang specimen po, kapag nag-positive ang pasyente, ipinadadala na agad sa Philippine Genome Center. And we undertake this whole genome sequencing. When you do the whole genome sequencing, dito nadidetermine kung may variant na makikita dun sa gene sequence niya. Hindi lang po UK variant ang pwede makita dyan. Makikita pa rin po kung may ibang variant na present dun sa genes ng tao na yon na tinest natin.
Now, in the meantime, Usec, if let's talk about the virus itself, B117, the UK variant. Do we know more about this now? I ask because over the weekend, medyo nagkaroon ng alarm yung mga tao when UK Prime Minister Boris Johnson said they're seeing evidence of higher degree of mortality. Now, of course, we have to qualify immediately. A lot of experts weighed in immediately and said, teka muna, kalma lang, we don't have the data yet. But has anything transpired over the next few days that tells us we know more about this virus?
Yes, as far as we know, sir, and as far as evidence would tell us, this virus is more transmissible, and that is with evidence already. It is 50 to 70% more transmissible. Ibig sabihin, mas nakakapanghawa siya. Pero yung lumabas po over the weekend, and which was stated by Sir Boris Johnson, pag tinignan ho natin, these are just preliminary findings. And he himself said that. Pag ho tinitignan ho natin at sinasabi niyang marami kasing kaso, maraming namamatay. And that is really something that you expect. All the more that when cases increase, the deaths might increase as well because there would be severe cases, the system will be overwhelmed, and then eventually there would be deaths. So yun ho yung pagpapaliwanag doon ng ating mga epidemiologists. But for this article nga, preliminary findings pa lang po siya. Wala pa hong conclusion doon. Hindi pa ito conclusive.
Ilse, can you tell us more about the genome sequencing? Kasi gaano katagal siya from the testing at malalaman yung results? Saka ano yung capability natin, yung genome center natin? Ilan ang kaya nilang gawin siguro within a day na test? Kasi parang ang bilis-bilis kumalat eh.
Yes, ma'am. The Philippine Genome Center, meron ho tayong malaking makina dyan to do that. It is a bit of a high technology na ininvestan ng University of the Philippines. It can run about 750 samples in just one run. And accordingly, according to the Executive Director, Dr. Cynthia Saloma, it would take up for them about 1 hour, 1 day only for them to do the process. But there are other things that they have to do, technical things, like there is bioinformatics, there is confirmation, collection, and also given all of these processes, they said it's going to be 5 to 7 days. But in the past 3 weeks, they were able to release results as early as the 3rd or the 4th day. So ito lang ho, nung naging 750 na yung samples, medyo nagkaroon lang tayo ng konting issues. That's why last week lumabas po yung resulta natin ay Friday na po ng hapon.
Ma'am, we do understand the need for the second confirmatory test just to take into account nga yung incubation period na 5 to 7 days. I'm wondering lang though, what then would be the need for a first test to begin with? Since they're all in quarantine anyway, why not just have the first and only test 5 to 7 days after they are quarantined, so that I don't know if it's more cost efficient, pero di ba, if you are considering lang naman the incubation period, I suppose that should cover it already.
Yes, sir. Actually, that is rational, no? That is very rational. But also, we would want to have an initial screening of all those entering so that we can already isolate those who will turn positive during that time on the first test.
Okay. Para may tabi na yung nag-positive. Okay, I understand now.
Ma'am, pag-usapan nga po natin ulit itong issue ng pagpapalabas sa 10-year-olds up to 14. Sabi po ni Mayor Chanco, nagtataka siya kung bakit pinapayagan silang lumabas sa mga mall samantalang hindi sila pwedeng pumasok sa eskwelahan. Ano raw bang klaseng values ang tinuturo natin nga naman sa mga bata na papayagan natin silang kumbaga makipagsapalaran sa mall pero hindi natin sila papayagan makipagsapalaran para sa edukasyon. Anong masasabi niyo ron?
Actually, I think I am not the appropriate person to answer this because it was not the Department of Health which has recommended this to IATF. Although I've heard Secretary Mon Lopez mentioning that in classrooms you have more interaction with fellow schoolmates and also with other people. And when you are in the malls, apparently he said that you are with your parents and it is going to be more controlled.
Sa eskwelahan kasi nagkukulitan yung mga bata eh.
But that said, ma'am, I mean, of course, the DOH and all our health institutions are represented in everything. Is there obviously these are tough dilemmas on the public health side and also on the socio-economic side. But given the discussions that take place in real time, what are the mechanisms and the protocols in place that would trigger a reconsideration of these decisions?
Oh, well, first, as I've said a while ago, we are going to recommend for just a temporary suspension of the implementation for this lessening of the restrictions for age requirements, specifically because of the existing variants. We know that these variants are very infectious and highly transmissible, I mean. So, ito po ang sinasabi ng ating mga eksperto, if only we will keep the cases low, and then these mutations of the virus, which really happens as part of their adaptive process, will also not happen. Because as long as there is a host na pwede silang magkaroon ng mutation, mangyayari po yan. So, ang sinasabi ko lang ho, if we lessen the restrictions, mas maraming taong lalabas, mas marami pong taong may infect, and therefore, mas marami pong chances that the variants may be here or may be produced.
Okay.
Ma'am, yung sa Negros, yung government doon are complaining about the LSIs na galing daw palang UK, hindi nagsabi, dumating doon, kaya ngayon may problema sila. Ganon. Are you recommending any particular measure to prevent this from happening again? Meron pa bang magagawa doon to prevent that?
Oh, well, unang-una po, no, katulad po ng mga nararanasan natin sa ngayon, no, nag-contact tracing po kami, ay medyo nahirapan tayo no, dito po sa pag-trace nito mga kasamang pasahero galing sa Dubai. So amin pong napag-uusapan naman po yan with the other agencies and we have recommended that there should be the stricter checking of the details of the patient or the individuals when they come in, and there should be a harmonized system that whatever the airport officials would have as a document, the BOQ and the other offices would also have, so that mas madali po tayo nakakahanap ng mga tao, nakikita natin din yung accuracy ng mga binibigay nilang mga detalye ukol po sa kanilang pagkatao. Ito pong nagsinungaling, nakapasok, it might be that I cannot assume or presume kung ano po ang nangyari, pero there should have been stricter checking also of the details of these patients, no. So, meron hong mga karampatang sanctions yan sa ating mga batas dahil sila po ay nagkubli ng kanilang mga detalye at ito po ay may public health emergency tayo.
Yeah. Ma'am, we'll talk more about this later with our next guest. But I did want to ask you about the saliva test na ngayon mag-uumpisa na, no? Now, of course, Chairman Gordon has always been saying this is going to be a game changer. It's easier, it's cheaper, mas madaling palaganapin, it's safer for the health workers. But as they say, we're all hopeful for it, but as they say, the devil is in the details. I'd also want to ask, is there anything in the details that we need to be mindful of? Are there things that the DOH would also manage people's expectations about, and at the same time put in the minds of any other groups that would want to propagate the saliva tests?
Well, I don't really understand what that would mean, no? But Dr. Micheal Tee is here. He's the proponent of the study. But I just like to say that the conditions of the department when we gave the approval to the Philippine Red Cross, the University of the Philippines College of Medicine, was that the saliva as alternative specimen would only be implemented in the Philippine Red Cross laboratories. And when they presented to us the study, the accuracy naman po was more than 98%. So
Yes.
so we are seeing naman that it's going to be accurate when we do that. Although our laboratory experts panel have recommended that we still closely monitor so that we can be able to see the direct concordance or the similarity with the nasopharyngeal swab, and we can guarantee that it's going to be really accurate, no, when tried in most number of people now that we are going to implement that. So yun pong para sa ibang laboratorio natin sa ating bansa, ito po ay papatupad pag natapos na po yung validation study naman ng RITM.
Okay, but in the meantime po, unahan ko lang po yung mga online posts. So, Red Cross lang ang pwede mag-administer nito for now. Does that mean pagka may nagyaya sa akin, may nag-message sa akin, oy, may saliva test ako, it's safe to assume that's fake?
Yes, sir. You cannot use that, and they cannot do that because they will be sanctioned. It's only Philippine Red Cross which was given the approval to use this.
Okay.
So yung mga offices, companies, will they be allowed to actually accept the results of the PRC saliva tests?
Yes, ma'am.
Pwede yun, sir, ma'am?
Yes, ma'am. Because the approval is there already, so it's going to be
Okay.
considered as an official result already.
Alright. Pati mga hospitals, ganoon, pwede na rin, ma'am?
Basta po Philippine Red Cross ang gumawa. Marami pong
Yes.
detalye kailangan i-consider kasi iba-iba rin po ang testing kits na ginagamit ng ating mga labs, and that was part of the study that was done by the University of the Philippines.
Yusek, meron din bang application sa inyo for, kasi ang alam ko sa saliva test, hindi na kailangan laboratory eh. Kaya nga siya napakabilis eh. Sisiksik lang siya doon sa machine, tapos
3 hours lang eh. Yeah.
Meron ba kayong ganong application? Because I understand sila Joey Concepcion was also working on bringing in saliva tests. Are there other applications for saliva tests with the DOH?
None so far, ma'am. The only thing that we have right now would be the saliva as alternative specimen. It's not a test. You still use it with RT-PCR.
Okay.
So it's basically the same lab procedure ng reverse transcription PCR, except na magkaiba lang yung pagkukuhanan ng specimen. The site, whether it's inside your nasopharyngeal area or the saliva from your mouth. Ilan po yung kaibahan?
Yes, sir.
Okay. Ma'am, in that particular case then, sorry, small detail lang. In that particular case then, bakit po limited lang sa Red Cross? If it's the same procedure anyway,
Yes.
why not po broaden it to all the other labs capable of doing RT-PCR testing?
Yes, sir. Alam niyo po, ang Department of Health is very open to that. But as I've said, there are a lot of processes that are different across the different laboratories. For example po, yung mga testing kits na ginagamit po ng ating labs, hindi lang po yung katulad ng ginagamit sa Philippine Red Cross. Meron pa po tayong mga ibang testing kits na ginagamit. Meron din pong ibang mga proseso sa ibang laboratories that hindi na po dadaanan itong saliva as alternative specimen. We like to try that also in our other laboratories. That's why our ITM is doing this validation study so that we may be able to implement it across all laboratories in the country.
Okay, so you may expand the list. Okay. Ma'am, binabanggit ni Ami kanina na non-lab saliva test. Have you heard of that? And is that reliable, do you think?
Well, I've heard of that. I've read about it. Nangyayari naman po sa ibang bansa na yan. But for now, wala pa naman hong nagsasubmit sa FDA ng ganito mga application para ma-try natin dito sa ating bansa.
Parang, but from your reading of the material, does it sound like it's a credible test? Kasi parang pregnancy test ba, di ba? You just apply and then you look at the result.
Yeah.
Well, sir, it has to be tried, no? Katulad po ng lagi naming sinasabi, lahat po ng teknolohiya, katulad ng diagnostic processes na ganyan na papasok sa ating bansa, kailangan po yan ay ma-rehistro ng Food and Drug Administration. And most importantly, it has to have a validation study with our National Reference Laboratory, which is our ITM. So dyan po kasi nakikita kung talagang itong test na to would yield sensitive and specific results at magbibigay ng accurate results para po dito.
Usec, would the government be open to a self-testing kit? Kasi sa US, in-approve na for EUA nung kanilang regulators yung LUMA, di ba? Home use. Are we open to that kind of testing?
Well, the Department of Health and the government is open to these technologies that can make government more efficient. Pero kailangan nga, katulad po ng sabi ko, try po natin dito. The setting in the United States may be different with our setting here. Marami po tayong factors na kailangan i-consider. So kailangan lagi ng validation study if it's going to give accurate results as well here in the Philippines.
Okay. Usec Vergeire, from testing to vaccination, any updates po doon, both on the level of our candidate vaccines that are coming in, the negotiations for that, and also our readiness on the ground, the readiness of LGUs, and for that matter, the private sector that's extending some assistance. Ano po yung mga updates natin dyan?
Well, sir, unang-una, tuloy pa rin ho yung ating mga negotiations, no? And kanina nga po, nagpalabas kami ng statement about COVAX kasi may lumabas po na article na sinasabi natin na baka hindi matutuloy yung 20%. Tuloy po yung 20%. Ang naging difference lang po dun sa COVAX facility, yung 15% po ay ibibigay na as subsidy sa atin, walang bayad. Tapos magka-counterpart ang Pilipinas ng 5% of this. So tuloy po, deliveries would push through on the said date that was given by the COVAX facility. As to the other vaccines, yun nga po yung sinasabi ni Secretary Galvez, that yung pong mga unang deliveries ay mangyayari by February 20, specifically yung 500,000 doses nito pong Sinovac, and then for the succeeding months, nandyan na rin po yung sa iba. As to the trials for this COVID vaccine, yun pong Janssen, Clover, and I forgot the other one. Sorry, Gamaleya yata.
Gamaleya, yes.
Yes, I'm sorry. We'll be starting already. These contract research organizations are now engaging with the Department of Science and Technology just to get some guidelines so that they can already assign areas kung saan sila pwedeng mag-umpisa na nitong mga clinical trials, and then after that they will be recruiting their participants already. Yun pong WHO Solidarity Trial for Vaccines, hindi pa ho nakakapagbigay ng protocol ang WHO at saka assigned sites, although we are already preparing for that. At yun pong ating proponent, si Dr. Jodor Lim, ay nag-umpisa na po dito sa mga ospital na napili. Dito naman po sa sinasabi na mga deployment, lahat po. Ito pong ating teams ng vaccine cluster, iikot na po sa mga local government. It will start, I guess, Monday, I think Wednesday, with Secretary Galvez and Secretary Duque leading these teams, going to the different local governments just to check if they are prepared already, makita kung ano pa yung gaps, makita po kung ano pa yung mga pangangailangan para mapunan na po ng national government. Master listing is ongoing. The deadline for them to be able to consolidate all at magkaroon tayo ng isang buong master list is on January 31. Logistical requirements as to the freezers and the other logistics, inihahanda na po, nakakapagkausap na po sa mga private institutions.
Usec, are you looking closely at the Janssen vaccine? Kasi maganda siya, single dose lang, Mas madali for administration, logistics purposes. Anong status ng negotiations natin with them? Saka, is there any growing preference for that vaccine?
Oh, well, at this point, we don't have any preference at all, ma'am. It is, as I always say, if there is an EUA that is issued by the Food and Drug Administration, that is acceptable to us already. Now, with the Janssen, the clinical trial has been approved. It's going to start here in the country. As to negotiations, it was also mentioned by Secretary Galvez before that there is this negotiation, At aantayin lang po natin maybe towards the 3rd and 4th quarter of the year po yan.
So ma'am, ano nang visibility natin in terms of vaccination this year? Kailan kaya likely magsisimula? at kailan kaya talagang mako-cover at least yung a substantial portion of the population, if not 70%. How does it look now?
Yes, ma'am. Actually, yung mga parating, yung sa COVAX facility at saka yung sa Sinovac, pag dumating po, apparently on February, we're just going to prepare, distribute, and have the local governments mobilized, engage. Siguro po mga March, makakapag-umpisa na po for the healthcare workers. Tuloy-tuloy po yan. And this is going to be around 1.7 million of them all, kung wala pong tatanggi. Tapos pagkatapos po niyan, makakapag-umpisa na rin ng some parts for the senior citizens kung dadating na nga po yung pinapangako ng mga bakuna for this March, April, and May. Meron na hong ibang bakuna rin kasi na nakita ko na rin dun sa mga dokumento na parating na rin po come May, magde-deliver na rin po sila. So magsusunod-sunod na ho yan. Although it's going to be in tranches, but I think it's going to be appropriate because we did our prioritization per sector. So matapos ang isang sektor, dadating ang isang sektor, like the senior citizens would be next and then indigent. So looking at all of this and with the plans of our vaccine teams, sa tingin naman po natin, kahit na po yung unang prioritization natin na 20%, with all of these vulnerable in this class A na nilagay natin na priorities, would be able to receive the vaccine for this year.
Matutuloy po kaya yung elections without any worry that, the COVID will still be a major factor? Because, it's going to be election season already. So, yun po ang tanong ng marami.
Well, I don't like to give a specific comment on that, But as we always say, whatever gathering this may be, if only we will be complying with the minimum health protocols, and hopefully by that time, a lot of people had been vaccinated already. So the chances of having this severe infections, hospitalizations would lessen, and hopefully the number of cases would lessen. Pero kailangan ho nating tandaan, ito pong mga bakunang nandito sa advanced stages, wala hong ebidensya that they can block transmission. Ibig sabihin, walang ebidensya na mababawasan ang pagkakahawa-hawa. Pero may ebidensya para i-lessen po yung pagkakasakit o magkakasimptomas at ma-lessen yung severity ng sakit at hindi ma-hospital.
Okay. Maraming salamat po, Undersecretary Maria Rosario Vergeire ng Health Department. Ma'am, thank you for joining us again.
Maraming
Salamat, ma'am.
Salamat po.
Thank you.
We will just go into a break, so please stay with us.
positive for COVID-19. But none of them has so far tested positive for the more contagious variant.
Ang kailangan natin gawin ngayon is strengthen natin yung current protocols natin. Kailangan yung quarantine and isolation protocols ng LGUs should be further strengthened.
The Health Department has approved the use of saliva for COVID-19 testing after a Red Cross pilot run.
Promise you this, pagka marami na nagtetest, papatunayan ko na kaya natin babaan yan dahil unang-una, bawas sa PPE. Tatluhan yung pinakamura niyan. Pero iba, nag-overcharge, sumabot ng 900. Sorry
Welcome back, the Chiefs here on One News. We are now in the final stage of our conversation. Now joining us is Philippine Red Cross Saliva Test Lead Researcher, Dr. Micheal Tee. Dr. Tee, welcome to the Chiefs.
Thank you very much and good evening.
Okay.
Good evening.
And of course, the big news today, finally, green light for the saliva testing that the PRC has been pushing for some time now. Just to refresh everybody's memory, apart from the difference in how we extract the sample, what else is different about the saliva testing?
The whole processing prior to RT-qPCR is changed. It became simpler. Before, you do RNA extraction. But with this process that was developed by Filipino scientists in the University of Illinois, we only had to heat it to a certain degree, a certain temperature, and then add lysine buffer. Meaning the virus is treated with detergent. The detergent is a usual chemical used in our laboratories. We add it in a certain proportion, 1:1, and then there you go. You run it in the usual reverse transcriptase quantitative PCR. And then you have it. It's still a NAAT or a nucleic acid amplification test. So it carries the same specificity as the swab test.
So in terms of results,
Dr. T, ibang-iba yata siya dun sa nabasa ko kasi the first time I heard about this was from Israel. Unang-una yung presyo nila, 25 US cents lang daw. Tapos pangalawa, they don't need the laboratory. They have this machine, para lang siyang yung pregnancy test. Sisipsip mo lang dun yung sample, tapos immediately labas na yung resulta. So, iba pala tong dinating dito sa atin.
Iba po, at hindi naman ito dinala pa rito because the reason we had to re-evaluate it is because Red Cross already had more than 40 of the machines and we had to adapt it. The technology has to be adapted to whatever machine we already have rather than buy a new set of machine.
Pero mura lang yung machine na yun eh. Maliit lang yun na machine.
Yes, ma'am. In fact, to digress, I'm also doing a validation study of that antigen test.
Yes.
That antigen test, I already have some stocks here in UP Manila, and we already secured a research and technical review clearance to be able to do that, to compare that so that we will know how accurate it is in terms of sensitivity, specificity, or what statisticians will call concordance.
Okay.
We are able to do that also.
Doc,
And I know that FDA has already approved some of the kits.
US, yeah.
No, even Philippine FDA.
ganun, antigen
that,
kits.
kind of, yes.
Wow, when?
But not saliva. It is still a swab. It's an antigen test.
Okay.
And there are kits being sold in the market. But I must caution our listeners, our viewers,
Yeah, iba yun.
that certain tests can be done at certain periods. And while these are available, we should allow our physicians, our healthcare workers to decide which test is appropriate.
Yeah, but
Like when we talk, go ahead.
Dr. T, yung machines na sinabi nyo na meron na ang Red Cross na nandiyan na, is that the only thing that's keeping these tests exclusively in the Red Cross right now? In other words, if LGUs or other institutions or other centers were able to get a hold of these machines, can they now run saliva tests outside of the PRC?
That is for the Department of Health to answer. Because when we did the study, our intention was really to make it available for the whole country. But our protocol is limited, of course, to match what you're doing to a certain machine. And if we are going to allow everyone to do it without quality control, then the danger of misdiagnosis, that's number one, or number two, overdiagnosis, will become a large problem. So, despite the fact that this is a UP project, underwent technical and ethical review, I myself was there. The Dean of the College of Medicine is part of the team. We have PhDs working on it. We had to submit to the regulatory bodies and allow ourselves to be scrutinized. Our result was scrutinized by the COVID-19 lab expert panel. And only after that did they say, yes, you can do a pilot implementation. And with that pilot implementation, we were fortunate that we were able to get immediately, within 3 days, 1,000 samples, of which 847 had sparing. In fact, the story there was that DOH was telling us, get the first 1,000 saliva sample, but for every 10, get 1 swab and then check. What the chairman of the Philippine Red Cross did, no, let's do everything in pairs. So with that more bold attempt to validate it, we were able to get 847 samples and nailed an accuracy of 98.23%. Now, as to other machines or other laboratories being able to achieve that same accuracy, we will have to evaluate using their own kit. You see, when we say kit, it means the reagents that are being used, the machines.
Okay.
It's a whole setup.
Pero Doc, the
Go ahead.
actual RT-PCR machines, are they all the same across the board? I'm talking about the PCR machines mismo, the amplifiers. Are they across the board the same, or are you looking at differences then that have to be taken into account?
Yeah, the principle is the same. You're right. It's all the same. It's about what we call thermal cycling. You heat, you cool it down, you heat, so that every time you heat, there is a process of separating the DNA, the nucleic acid, and then copying each separate to make a pair, and then doubling it every time. That's the process. However, the difference would be in the primers. So the primer is what you use to identify the gene in your sample. So if the primer attaches to a certain gene and then it propagates or elongates, you make it grow. No, it's like matching a fertilizer to a certain plant. So it grows and then you have now 2 plants, and then you cut the plant again and try to plant it again. It grows, you now have 4 plants.
Okay.
You cut them in 2, plant them again, you have 8 plants. And then at a certain point, you'll be able to identify the field as a rice field or a field of santol or a field of mango, even from the airplane. That's how it works.
That's the
when you see
amplifying,
only 1
yeah.
or 2 trees, you cannot see. Is that a field of mango? No, maybe kaimito.
Well,
But
Doc,
then the
ganito po.
farmer
Sorry, Doc, let me just break in.
Right.
Para po in layman's terms, kasi po, medyo nakakahilo yung kinikwento niyo eh. When you talk about primers, I'm thinking about painting eh.
Oo nga eh. Napahamon ang utak ko sa biology ko or ano, no?
Pero Doc, in layman's terms po, what you're saying po, tell me if I'm getting this right. In layman's terms, is there any difference that we should take into account between the swabbing and then RT-PCR testing versus yung saliva test and then RT-PCR testing? Are they basically the same in terms of results? Or meron bang distinctions or differences yan that we have to take into account? Like for example, gantong variety, hindi yan lalabas kagad, o gantong variety, hindi ganun ka-clear ang result?
2 yung questions mo. Accuracy, yes, you'll get the same accuracy.
Okay.
If you're using the same machine and using the same process that Red Cross and UP developed, 98%. Now, interesting yung question mo eh. Will there be a variety or a variant that may be missed? Technically, yes. No? But it will not happen with the Red Cross machine. if you read the variant, the UK variant, there is what we call, and you can Google this now, the S drop. No, the S drop is a gene that is not detected when you're using a detector that can detect only the S gene. So ganito yan. You have a scanner. The scanner is specific. In the Red Cross case, it will detect the ORF1. So that's one. Number two, it will detect the N, a gene. The third that is used by other laboratory is the S gene. Now, since Red Cross is not using the S gene to detect anything, it will not miss a patient because they have COVID variants. Now, the other laboratories that may be using an S detector will miss it because the COVID variant sometimes will show as a S drop.
Sir,
Go.
ganito na lang. Hindi ko masyado masundan yung mga...
May quiz to, may quiz, Lucy, ha? Bago nyo pa tanungin nyo muna. I-quiz nyo muna bago magtanong.
Doc, gusto ko lang maintindihan, babalik ako dun sa tanong ni Robbie, no? Ang tanong lang naman is, ano yung probability na replicate yung ginagawa nyo sa PRC, sa LGU level, halimbawa, where testing is really important, where it really needs to be done, and so that it's more accessible at mas marami tayong tests na magagawa. I mean, what is needed in terms of resources? Is it the lab equipment? Is it the kits? Do we have to buy a new one like the one of PRC now? Or can we use the existing ones?
DOH. It just needs DOH support and approval.
Oh, really? Ganun lang kasimple? And then...
Yeah, because
It's basically the same machine.
Usec Vergeire was mentioning earlier, they are already working with the RITM to look at the several validation studies that RITM is doing. It's just that RITM is not able to do it as fast as what Senator Gordon was able to do. Gather 1,000 patients in 3 days. That's
So
the main
pwede.
issue.
But that's part of our question. Is it just the technology? Is it just the equipment? Or let's say, to Ami's point kanina, kung affordable naman yan, bumili na ako ng equipment, I have all the labs. But what about on the human resource side, on the process side?
Training.
And the training. Is it once I have the equipment, is it a simple rollout from there?
You know, it's the same. You have the same kit. No? When you talk about it that way, you have the machine. The machine needs a kit. The machine is like a Xerox machine. You need the ink.
The toner.
That's the PCR polymerase kit. That's what you put in. However, in the Red Cross, we use saliva versus swab. In the other laboratory, they use swab because they don't have the approval to use the kit for saliva.
So approval lang talaga to. Ang kailangan.
But again, the approval requires a validation, and that validation is already being done by RITM. So the question on whether it can be done by other laboratories, the answer is yes, but we have to submit to the regulatory bodies. I'm sure you've heard Senator Gordon say that we submitted the test in October. And then it was scrutinized, really scrutinized for its accuracy, because the Department of Health will not approve it left and right just because it's submitted, no?
So, Doc, Doc,
balikan ko lang yung tanong ni nahirapan si Ed, ha? Pwede nyo ma-detect yung variant, pero yung ibang laboratory, hindi kayo sigurado with the saliva test.
The variant loses a gene. Always, ano?
Kailangan yung genome.
Always the gene.
Yeah.
We detect 3 genes in some laboratories, S, N, and ORF. In Red Cross and some other machine will only detect 2 genes. And luckily, S gene is not among the genes that we are trying to detect in the machine of Red Cross. So,
So, hindi nyo kaya?
hindi kami apektado. Hindi
Okay.
kami maapektuhan. Ngayon, kung ang tanong makikita ba yan sa laway o makikita yan sa swab? Yes, makikita po siya dapat kung kayang i-detect ng machine.
Doc, teka, let me try to summarize, Doc, para siguradong klaro sa atin lahat. So we're basically talking about the same machine and almost the same test kits. It's just a matter of us
process.
going through the processes of approval to make sure that the people doing the testing are properly trained and certified to be able to go through the process. Tama ho ba?
And the process, dalawang process mo eh. Isang process of the approval and the other is processing. Paano mo pinroseso yung laway?
Opo, yun po.
Yeah.
Oo, no?
So mas
Pwede
nandun
mong
po
prosesuhin
yung
administratibo, pero kailangan mo ring prosesuhin yung laway.
Opo.
Ang laway ng Red Cross, pinroseso sa pamamagitan ng pagpapainit at nilagyan ng detergent.
Opo,
Okay.
Para dinetergent, nasira yung virus, lumabas yung RNA.
RNA.
Yung RNA ngayon, sinirox mo ng sinirox.
Amplify.
Tinig mo.
Oo.
Kung sinirox ko na to, dumami, yung ba yung nakita ko? Yung ba yung COVID-19 virus o SARS-CoV-2? Nakita natin sa Red Cross na yung sample na nakuha sa ilong ng isang pasyente at saka yung sample na nakuha sa saliva, sabay kinuha, sabay pinroseso, tumutugma 78 beses sa kada 100 test.
Okay.
Ngayon, yung ibang, the other laboratories, you do not know. Because the process of collecting saliva and processing the saliva is different from processing the swab. The swab here is placed in a transport medium. Nilalagay sa malamig na lugar bago dadalhin sa laboratory. Samantalang yung laway, ang laway na kinokolekta namin, nilalagay lang sa isang lalagyan, idudura mo, hindi ka dadahak ha, dudura mo lang. At pagkatapos ng idura, dalhin mo sa laboratory, walang pinag-uusapan na temperature. Ilalaban na yan sa makina. Titignan kung may makikita dyan. Parang detective lang yung primer. Meron ba akong makikitang may mancha rito ng ganitong kulay? O, nakita niya, meron. At madedetect yun. Ngayon, yung ibang machine, when we talk about their process, the saliva, where will they place it? Number 2, the saliva, how will they process before putting the primer? Yung primer kasi yung parang detective eh.
Opo. So it's not a technology issue anymore. It's an issue lang of human resources, training, skills, and processes.
And process.
Opo.
The process of getting the virus from the sample. Magkaiba yun eh. Yung tama ka, human resources, noon, problema yon. Pero ngayon, hindi na masyado kasi same laboratory personnel can do that.
Okay. Okay. Doc, I think we got it more or less. Dumudugo na ilong namin eh. I think we have a very good idea now. A much better idea. Doc, maraming salamat po for joining us. We really appreciate
Thank you, Dr. Micheal Tee.
all the information you gave us.
Salamat, Doc.
Maraming salamat po. At we hope to have you again
Yeah.
for a fuller discussion. Okay, that was Dr. Micheal Tee ng Philippine Red Cross Saliva Test Lead Researcher. So thank you, Doc. And that'll be all for this Monday edition of the Chief Yoke. We'll discuss here. We'll keep the conversation going. I'm Ed Lingao.
I'm Ami Paminton of the Philippine Star.
I'm Lucy Cruz Valdez of News 5.
I'm Robbie Alampay, and we are One News.